Have you ever noticed what you see in the toilet and simply flushed without a second thought? Most people assume stool is just waste, something to ignore and forget. But here is what many miss. Your stool is actually a daily report card from your digestive system, your liver, your gut microbiome, and even your cardiovascular health. The color, shape, consistency, and smell of your stool can reveal silent problems long before you feel pain or discomfort. Today, I want to walk you through the most important stool changes you should never ignore, especially one type that can signal a life-threatening internal bleed. If you recognize it, seeking help immediately can save your life. By the end of this video, you will know exactly what is normal, what is harmless, and what demands urgent medical attention. Let me start with a fundamental point. Stool is not random. It is the end product of a complex process involving your stomach, liver, pancreas, gallbladder, small intestine, and colon. Each organ adds enzymes, bile, mucus, and bacterial byproducts. When everything works smoothly, stool should be medium to dark brown, form but soft, easy to pass, and only mildly odorous. This color comes mainly from bile, which is produced in your liver, stored in your gallbladder, and released into your intestines to digest fats. Bile starts out greenish-yellow, but as it travels through your gut, bacteria break it down into a pigment called stercobilin, which gives stool that familiar brown shade. If any part of this process is disrupted, the color, texture, or smell changes, and those changes are clues. One of the most dangerous stool types is what doctors call melena. Melena is stool that looks black, tarry, sticky, and has a very foul odor. This is not the kind of black you see after taking iron supplements or eating certain foods. Melena has a distinctive appearance. It is shiny, almost like road tar, and it smells much worse than normal stool. Why does this happen? Because melena means there is bleeding somewhere in your upper digestive tract, usually the stomach or the first part of your small intestine. When blood sits in your stomach or small intestine for several hours, it gets digested by stomach acid and enzymes. This process oxidizes the hemoglobin in the blood and turns it black. By the time it reaches your colon and exits your body, it has that tarry, sticky texture. Here's the part most people miss. Melena is often the first and only sign of a serious internal bleed. You may not feel pain, you may not vomit blood, but inside, you are losing blood slowly, and over time, this can lead to severe anemia, dizziness, fatigue, shortness of breath, and even shock. What causes melena? The most common causes include stomach ulcers, which can develop from chronic use of non-steroidal anti-inflammatory drugs like aspirin or ibuprofen, or from infection with a bacterium called Helicobacter pylori. Gastritis, or inflammation of the stomach lining, can also bleed. Esophageal varices, which are enlarged veins in the esophagus often seen in people with liver cirrhosis, can rupture and bleed. And in some cases, melena is the first sign of stomach or esophageal cancer. The key message here is this. If you ever see black, tarry, sticky stool, do not wait. Do not assume it is from something you ate. Do not try to treat it at home. Seek medical care immediately. A simple stool test can detect hidden blood, and an endoscopy can find the source. Early detection can prevent life-threatening complications. Now let me talk about other stool colors and what they mean. Very pale, clay-colored, or whitish stool suggests that bile is not reaching your intestines. This can happen if your bile ducts are blocked by gallstones, a tumor, or inflammation. Tea can also occur in liver diseases like hepatitis or cirrhosis, where bile production is impaired. Pale stool is often accompanied by dark urine and yellowing of the skin or eyes, a condition called jaundice. If you notice pale stool, especially with these other signs, see a doctor promptly. Bright red blood in or on your stool usually comes from the lower digestive tract, such as the rectum or colon. It can be caused by hemorrhoids, anal fissures, or polyps. While less urgent than melena, persistent red blood should still be evaluated, especially if you are over 40, because it can be an early sign of colorectal cancer. Greenish stool is usually harmless and often caused by eating lots of green vegetables, taking iron supplements, or food moving too quickly through your gut. But if green stool is persistent and accompanied by diarrhea, cramping, or fever, it could indicate an infection or other digestive issue. Stay with me for this next detail, because shape and consistency matter just as much as color. In clinical practice, we use something called the Bristol stool chart, which classifies stool into 7 types. Type 1 is hard lumps, like nuts, and indicates severe constipation. Type 2 is lumpy and sausage-shaped, still constipated. Type 3 and 4 are considered ideal, smooth, soft, easy to pass, shaped like a sausage or snake. Type 5 is soft blobs with clear edges, still acceptable but on the loose side. Type 6 is mushy, fluffy pieces with ragged edges, and Type 7 is watery, no solid pieces, which is diarrhea. Chronic diarrhea, especially lasting more than 2 weeks, can signal infections, inflammatory bowel disease like Crohn's, or ulcerative colitis, food intolerances, or even thyroid problems. Chronic constipation, on the other hand, can be caused by low fiber intake, dehydration, lack of physical activity, certain medications, or conditions like hypothyroidism. But here is what concerns me most. Very thin, pencil-like stool can indicate a narrowing in the colon, possibly from a polyp, scar tissue, or tumor. If you notice this change persisting for more than a few days, get it checked. Odor is another clue. All stool has some smell, but extremely foul, rotten-smelling stool can indicate poor digestion, bacterial overgrowth, or malabsorption disorders like celiac disease or pancreatic insufficiency. Greasy, floating stool that is hard to flush often means your body is not absorbing fats properly, which can happen when the pancreas is not producing enough digestive enzymes or when bile flow is reduced. This is called steatorrhea, and it requires medical evaluation. Let me pause here and say something important. Many people try to self-diagnose or assume these changes are temporary and will resolve on their own. Sometimes they do, but when it comes to stool changes, especially those involving black tarry stool, bright red blood, persistent pale stool, or thin pencil stool, waiting can be dangerous. These are not just digestive quirks. They are your body's way of asking for help. In Japan, there is a strong culture of regular health checkups, and one of the most common screenings for people over 40 is the fecal occult blood test, which detects hidden blood in stool even when you cannot see it. This simple test has saved countless lives by catching colorectal cancer and other serious conditions early. If your country offers similar screening programs, take advantage of them. Prevention and early detection are far easier than treatment of advanced disease. Now, let me talk about medications and supplements. Certain drugs can change stool color in harmless ways. Iron supplements often turn stool dark green or black, but this is different from melena. Iron-related black stool is usually dry and does not have that sticky, tarry texture or foul odor. Bismuth subsalicylate, found in some antacids and anti-diarrheal medications, can also turn stool black. Activated charcoal does the same. These changes are expected and not dangerous. However, other medications can cause real harm. Long-term use of aspirin, ibuprofen, and other non-steroidal anti-inflammatory drugs can erode the stomach lining and cause bleeding. If you take these drugs regularly and notice any stool color change, talk to your doctor. Blood-thinning medications like warfarin or newer anticoagulants can increase bleeding risk, so any sign of blood in stool should be reported immediately. Here's another point many people overlook. Diet plays a huge role in stool health. In Japanese dietary culture, there's an emphasis on balanced meals with rice, vegetables, fermented foods like miso and natto, fish, and moderate portions. This kind of diet naturally supports healthy digestion. Fiber from vegetables, whole grains, and legumes adds bulk to stool, making it easier to pass and preventing constipation. Fermented foods provide beneficial bacteria that support gut health. Adequate hydration is essential because water softens stool and helps move it through the colon. But the reality is, in our modern world, many people eat too much processed food, too much red meat, too little fiber, and drink too little water. This combination can lead to chronic constipation, hemorrhoids, diverticulosis, and even increase the risk of colorectal cancer over time. Let me give you a few practical steps you can take today to support healthy digestion. First, drink water consistently throughout the day. Thirst is a delayed signal, especially as we age. By the time you feel thirsty, you are already mildly dehydrated. Aim to sip water regularly, not just when you are thirsty. Second, include fiber-rich foods in every meal. Vegetables, fruits, whole grains, beans, and lentils are excellent sources. Fiber helps regulate bowel movements and feeds the good bacteria in your gut. Third, move your body daily. Walking is one of the simplest and most effective ways to stimulate bowel motility. In Japan, walking is built into daily life through public transportation and active commuting. Even a 15-minute walk after meals can make a noticeable difference in digestion. Fourth, do not ignore the urge to go. Holding in stool for long periods can lead to harder, drier stool and increase the risk of constipation and hemorrhoids. Fifth, limit processed foods, excess sugar, and excess alcohol. These can disrupt your gut microbiome and promote inflammation. But the real issue is that many people do not connect their lifestyle choices with their stool health. They think digestive problems are just bad luck or aging. But the truth is, your gut is highly responsive. Small changes in diet, hydration, and movement can produce noticeable improvements within days. And over the long term, these changes reduce your risk of serious diseases like colorectal cancer, diverticulitis, and inflammatory bowel disease. Now, when should you see a doctor? If you notice black tarry stool, see a doctor immediately. If you see bright red blood in your stool, especially if it is persistent or you're over 40, get evaluated. If your stool is very pale or clay-colored, especially with dark urine or jaundice, seek care. If you have chronic diarrhea lasting more than 2 weeks, see a doctor. If you notice persistent pencil-thin stool, get it checked. If you experience unexplained weight loss, severe abdominal pain, persistent bloating, or changes in bowel habits that last more than a few weeks, do not wait. These could be signs of serious conditions that require prompt diagnosis and treatment. This content is for general educational purposes. If symptoms are severe, persistent, or concerning, consult a qualified clinician. Let me close with this. Your stool is not something to be embarrassed about or ignored. It is a window into your internal health. Paying attention to it, even for just a few seconds each day, can give you critical information that helps you catch problems early. In Japan, there's a concept of mindful awareness, not just of food and movement, but of the body's signals. This awareness is not anxiety, it is responsibility, it is self-care, and it is one of the simplest, most powerful tools you have for protecting your long-term health. So, starting today, take a moment to observe. Notice the color, the shape, the ease of passage. If something seems off, trust that instinct and seek guidance. Your body is always communicating. The question is, are you listening? If you found this video helpful, please like, subscribe, and share it with someone who might benefit. Early awareness can save lives. And let me ask you one question. Have you ever noticed a stool change that worried you, and what did you do about it? Share your experience in the comments. Your story might help someone else take action. Thank you for watching, and take care of your health.